Hello, ladies and gentlemen. My name is Zina Nguru. I'm a counseling psychologist at Melchizedek Hospital. I'm excited about this opportunity to partner with Ponea Health and to bring you this amazing presentation on anxiety. Anxiety can be described as an intense feeling of fear, worry, concern, and uncertainty about an unsure outcome. Some of the causes, some of the things that have been identified as to bring anxiety amongst people is number one, a personal history of trauma. You may have undergone a traumatic event, and long after the event has passed on, you found that one of the complications arising from that event was issues to do with anxiety. It could be also be genetic or hereditary. You may be coming from a family history of where people have suffered from anxiety disorders. It could also stem from withdrawal from use of an illicit substance. Some of the risk factors of anxiety, well, I've already mentioned a bit in terms of genetic, in terms of having a family history of anxiety disorders, also some certain personality traits, and of course, if you're using drugs. Some of the key signs and symptoms of anxiety is number one is you're restless. Another one is a feeling of being keyed up and on the edge. We're talking about also sleep difficulties, difficulties in concentration, difficulties in memory. Those are some of the key signs, and also being easily irritable. Those are some of the key signs of being anxious. Now, the interesting thing is that we're all no one is immune from suffering from anxiety, not even kids. Children also do suffer from anxiety, and some of the most common anxieties that are seen in children is separation anxiety, and something else that is also referred to as selective mutism. So anxiety, we're all at risk and we're all prone to developing anxiety simply because there is no limit to the number of things that can make one anxious. Some of the treatment options if you have anxiety is number one, medication. Again, it is not a must, but in some instances, medication can be used in the treatment and management of anxiety. And for that, you'd need to see a general practitioner, or you could also see a psychiatrist. Another way in which anxiety disorders are managed is through counseling and psychotherapy. And you'd be able to come in for a session and we go over issues and concerns that are making you nervous and bringing about this anxiety. Those are some of the major treatment options for one, with anxiety. Ladies and gentlemen, it has been an absolute pleasure and joy bringing you this session. You can book my services through ponea.com. Thank you, and I look forward to hearing from each and every one of you.